Nowadays, everything is all about beauty and anti-aging. The red carpet stars, they appear all flawless, following a lot of procedures made, but it's very common to see their beautiful faces distorted or even disfigured by such procedures. The industry has grown so much exponentially that we look around us so much bad results. This is because physicians or even practitioners tend to overcorrect the defects instead of a holistic approach. The 30-minute facelift. It is a holistic approach, but at the same time addresses in minimally invasive procedures the aging skin. The 30-minute lift encompasses a number of different minimally invasive procedures, namely Botox, hyaluronic acid, and thread lift. My approach is not just Botox and fillers. It is not just filling up lines or restoring volume. With my 30-minute facelift, you will have in 30 minutes a new you. I will correct with minimally invasive procedures all the signs of aging, but without distorting nor disfiguring your face. My method is a bestseller to people who do not want to change the way they look. They just want to look the same, but with a more youthful and rested look. This is why a lot of celebrities and A-listers entrust their skin maintenance and their skin improvement to my 30-minute lift. The first signs of aging become with photo damage, actinic damage, and those are the darker patches and uneven skin tone and complexion that starts to appear somehow in the late 30s and early 40s. Expression lines of the forehead and around the eyes, as well as on the nasolabial fold, are another sign of aging. Loss of facial volume enhances the upper eyelid drooping, but also starts creating the tear throw lines, as well as the uneven shape of the jaw. In my practice, everything starts and finishes with a chemical peel, and that should be bespoke and tailor-made for every individual patient. A chemical peel will address all imperfections of the skin surface, dilated pores, blemishes, but also uneven complexion. The 30 minutes facelift actually takes me to perform it 30 minutes, and the results may last up to 1.5 years. The downtime is minimal. There might be some bruising, but this resolves within 2 or 3 days. I will now show you the 30-minute facelift. That is a combination treatment. It comprises a little bit of everything. Hyaluronic acid fillers, botulinum toxin A, thread lift, silhouette soft lift, and chemical peeling. In order to have the final finish, I shall plan ahead for a PRP session as well as hyaluronic acid mesotherapy in about 2 or 3 weeks' time. Our aim here is to lift altogether the face. So basically, we need to lift the eyebrow arch, which has been falling. Now, Botox will help up to a certain extent into that. However, a little bit of hyaluronic acid will actually give back the shape on the arch of the eyebrows. We also need to address the jawline. Here I plan to apply Silhouette Soft thread. It's an absorbable suture, and along this suture we have small absorbable pyramids. Those will grasp the soft tissue and will give an immediate lift on the jawline. We will address the sagging skin on the cheeks. We will position some PDO threads just to give firmness on the cheeks. Hyaluronic acid will also address the fine wrinkles on the upper lip and around the mouth. Comes into thread lift, whether this is Silhouette Soft or PDO threads. We need to plan our job ahead. This is because we need to actually allocate the entry points and then inject local anesthetic accordingly. For a jaw lift, we will work with one silhouette lift along the jawline that will give an immediate lift. I will now inject some local anesthetic on the entry points. Now with Silhouette Soft, we have 2 cannulas, and those can actually give us more versatility as to the traction that we can give with the threads. We always make sure that the cannula runs underneath the epidermis. And as you see, the cones will catch the soft tissue and give us a little traction. There we are now. We have positioned perfectly. We will now cut the 2 edges. I will now give back the shape of the brow. Botox may lift the upper brow, but just because it has lost a lot of volume, we will just try to bring it back to where it was, keeping the shape of the orbital area. For the eyebrow job, I use a small little needle for the entry point, just right here. I will use a fine cannula. This will actually spare us from the probability of getting hemorrhage or a bruise around the orbital area. My 30-minute facelift is the only way to prevent the signs of aging without distorting your natural beauty.